Hi guys. I decided to do a really quick live with my periodontist. This is Dr. Friedman.
Hello.
And he comes into my office every now and then to place implants for me or do gum grafts and surgeries involving the bone and the gum tissue. So I'll just wait for everyone to kind of get on, and then we're going to ask him about implants today. So if this is something that you guys want to know, then stay tuned because we have some really good info for you. All right, looks like some people are coming. Go ahead and ask your questions and we'll answer them later. I'll go through the live again later and I will check all your questions and try to get back to you guys. So we're gonna start today with talking about dental implants. So explain to everybody what a dental implant is.
So dental implants are essentially titanium fixtures, or essentially a screw that fit into the bone, and out of luck we discovered maybe 20-30 years ago that implants actually will integrate or fuse with the bone to a degree based upon the properties of the metal that's used, which is typically titanium, and there's various alloys that are used as well, but the titanium and the bone basically play nice together, and the implant will fuse to a certain degree with the bone, and upon the fusion, essentially you've got a fixture that sits inside your jaw, either the top or bottom, and because it's stable enough and it doesn't move, we can then go on and place a tooth on top of that. So that's the basic idea of how an implant works, and we've been making advancements either in the shape of the implants or the surface treatments since they've come about.
Okay, so explain this little model that we have here so people can see a sample.
This is not what would go into a human's mouth. This is just an enlarged version so people can recognize this model's various degree of taper as well as the number of threads. You can see it's very similar to a screw because initially implants that go into the mouth require some type of frictional grip or retention, as we call it, and that's so that they'll be stable. After about 3 months of that stability, the implant sitting in the bone, your body does the rest of the work by growing very closely to the various threads. So this system is just designed to show either the doctor who's looking at adopting it or the patient what the threads look like.
Right. So this is actually a really large size, but this is to show what goes in the bone. And then from the bone, once it's integrated with the bone, we place an abutment. So if we want to show what the abutment is, it's another piece that connects, this will connect the crown to the implant. Right, and the implant will be covered with tissue around it and bone. So this will stick out of your gum tissue, and then that's where I come in and I place the crown over that. So we kind of work together as a team when it comes to this. Placement of implants is really important. I work with Dr. Friedman because he does everything in a very predictable way, and I know his technique of working, and I love it. So that's why I work with him. But now we're going to get into more questions about this. People always ask me, is it painful? So I'll let you take over.
Unique nature of the bone, and probably most people know this, is if you look at the color of the bone, it's white. The whiteness of the bone is a result of a lack of blood supply. If you look at our lips, if you look at your gums, you'll see that it's very red, and that's a result again of blood supply. So interestingly enough, the body is designed, or came to be designed, in a way where you have blood supply and nerve where you need it. So in fact, the teeth have a great deal of innervation. You can feel your teeth. If something's too cold, if something's too hot, you can feel it because there is a nerve inside of there. There's also an artery and a vein that go inside to feed that nerve so that it stays alive. And anyone who's ever had a root canal knows that if the nerve is dead, we need to remove that nerve tissue. They also remove the blood supply. Inside a normal tooth, that nerve runs towards the bottom and then runs typically in a canal or along a specific space within the bone. But the bone itself doesn't have a great deal of innervation nor blood supply. And so surprisingly enough, placement of a single implant is probably one of the least painful procedures you'll have periodontally or surgically in the mouth, because there's not a great deal of innervation, I should say. Depending upon any additional procedures that you might need, there might be more complexity. You might have the possibility of a little bit more sensation. But a single implant placement that's going into an area of bone that doesn't require additional procedures has minimal sort of pain experience. It's not pain-free, nothing's ever pain-free, but most patients might take some ibuprofen afterwards, and I have to actually remind them to take it even though they're not feeling pain, so that we can keep any swelling or inflammation down just for the first 3 days.
Yes, and so along with that, I was going to say, what's the downtime? Because you are doing a surgical procedure, so what would be the downtime for that? Like, can you go to work after? Can you work out? What are your limitations as far as foods to eat?
So I can tell you that my dad immediately asked me, when can I go back to work? I said, you can go back to work as soon as the appointment's over if you'd like. Everyone's a little bit different in their sort of sensation afterwards, but there really aren't many limitations. Most straightforward implant placements don't require you to take time off of work. You can be completely out and functioning. As far as exercise, depending upon where the implant goes, typically there really aren't many limitations. We don't want you to exercise that day because there's still an incision quite often, so you have the potential for some bleeding, so we want to avoid that. But after about a day, you're ready to go. Remember that in the mouth, we eat foods all the time, things like tortilla chips, hot foods, pizza, soup. You've done a procedure to yourself where you've either done a chemical peel with your hot pizza, you've burned the roof of your mouth and it heals in a few days, you've eaten a tortilla chip and it's punctured the roof of your mouth, it's healed in a few days. So the mouth has an amazing potential to heal relatively quickly, and with dental implants, typically we don't have a lot of rules or limitations afterwards of what you can and can't do. So you can go about your day and go about your life.
And for patients that are really, really afraid of doing the procedure, we offer IV sedation, or Dr. Feynman also does a lighter sedation than that, so that you could be really relaxed during the procedure. But just having local anesthetic is also enough. You guys know Sandy, my office manager, had that done, and she just had it under local and she was fine. I think we did a little video for you guys way back when. So now on to my next question. Sometimes people tell me they're allergic to metal. So can we go over titanium implants and people that complain about being possibly allergic to it?
Okay, there's been a lot of examination of metal allergies throughout history, specifically with metals such as nickel, because if you've ever gotten a ring that's made out of nickel, you know that you've got a green band around your finger or wherever that metal's in contact. Certain metals do cause reactions. Allergic reactions with titanium have really not been documented much in the literature. Specifically, if you look at literature involving dermatology, they've placed titanium discs into the tissue, and they found that there's very minimal reaction. Surprisingly, titanium is found throughout the world in things that we touch. Like if you look at this wall, the white paint most likely got its color from titanium. If you look at certain foods, the FDA has a certain amount of titanium that's allowed in those foods as a whitening agent. So things like mayonnaise, things like letters, ranch dressing, certain letters you find on candies that rhyme with N, like let's say N and N, it would be the candy letter on top of that is painted with a white color. That's probably coming from titanium. Marshmallows, toothpaste will have titanium. So for the most part, there's not really a lot of documentation of allergy to titanium specifically. There are titanium alloys, and that means that they have other metals inside of them that the patients can have an allergy to the other metals. But typically the titanium used in dental implants, there have not been really many recorded, documented cases of true allergies. Hip implants, people have had issues with hip implants that were made of titanium, but that's an old design where the titanium was rubbing up against other titanium, causing particles, and those particle sizes were what caused the problem, not the titanium itself. So again, titanium, it's in your food, it's on your paint, highly unlikely, but if someone has a recorded case of a true allergy, there are other things that we can do, other types of implants that we can use.
Very good. And we can consult for that later if that ever is a problem. Okay, so next question. How about patients who are smokers?
So smoking has an interesting set of limitations that it presents with for our patients, but it doesn't mean that you cannot have an implant. It just means that your implant success rate is going to go down, and the lifespan of your implant is also going to go down in its duration. So really not a lot of documented benefits of smoke on implants, really, it's quite the opposite. Smoking just affects our immune system. Mm-hmm. It's going to affect our blood supply. And you think of the daily insult from bacteria around teeth, implants don't have as much blood supply around them. So you add smoking on top of that, your immune cells don't have the ability to show up and defend you from the bacteria.
Right.
So the implants just have a lowered success rate. And the reports are anywhere from 10 to 20% less success, which means you're looking at about 80 to 90% success rate. It's still not the best, but it's still pretty good. So
still pretty good.
Smokers
we
still
obviously don't want you to smoke, but you can have an implant placed if you do smoke. So how about patients with systemic conditions such as diabetes?
Yeah, diabetes is one of the biggest challenges that we have. Again, it affects the patients in a lot of the same ways as smoking. It affects your immune system. So if the patient is a well-controlled diabetic within specific parameters, their success rates are pretty good. In fact, probably a little bit better than those of smokers, not as good as non-smokers. But again, patients with diabetes still do get implants. We just look to work with their medical doctor and with them to get their diabetes under control on a daily basis. And there's some numbers that we look for, some tests that the medical doctor takes with them and that they supply us with. And we use that information to help schedule the best time to start with the implants and hopefully to continue to control the blood sugar and help the implant.
Right. So basically, if you have systemic conditions, you have to let us know, but we'll find a way to make it as best as we can for you to make sure that it lasts. And then, who needs dental implants?
Okay, so anyone who's missing a tooth, and especially not your wisdom teeth, we're not looking to replace those. But if you have a missing tooth, the major benefit is that traditionally in dentistry, we had to place a crown in front and a crown in back and put a fake tooth in the middle, a bridge.
Yes.
The major advantage now is that we can save those teeth that are neighboring. We don't have to cut into them. And if you're missing a tooth, the best thing to replace your missing tooth is a dental implant. So anyone who, let's say, had a traumatic accident, broke a front tooth, and that tooth either came out or had to be taken out, someone who's congenitally missing a tooth, someone who had to have a tooth taken out because the cavities were just so bad and had to be extracted. Even patients who are wearing dentures right now and their dentures don't fit so well and are loose, there's ways that we can use implants together with their dentures to help give them something called retention. Essentially keep the denture from moving around, taking advantage of at least maybe 2 implants to help hold that denture in. And quite often we can use the old denture and just make some adjustments to it in relation to the implants after the surgery. So anyone who's missing a tooth that needs function, those are people who can benefit from an implant.
And I actually prefer implants over bridges if you're able to have one, if you have enough bone and all that fun stuff, because like Dr. Friedman mentioned, you save the neighboring teeth and you also distribute the forces onto the teeth evenly versus putting torquing forces on one tooth here and one tooth here in a big space in the middle, which can then affect the roots of your teeth. So that's why I prefer them. And also we have so many advancements, and even if you're missing a tooth in the front, it's a great option to have an implant placed. It could look very, very natural if it's done right. So, and he's a great master at doing stuff like that. So I love that. And then let's talk about those billboards you see, like implant in 1 day, get your implant, $299 or whatever the ridiculous fee is that's so minimal. How is it possible that you can place an implant and an abutment and a crown in 1 day and have it be successful? Or is it not possible? Like, what's the best way that you know how to do it?
So I get that question a lot from patients, and to me the bottom line is, what would I want to have done for myself? The benefits of not doing everything all at once is that you are actually recognizing and respecting the individual. Every one of us is different. We have different aesthetic demands, meaning the appearance. We have different tissue that we're working with. We have different bone that we have available. Sometimes there's procedures that need to be done before. Sometimes there's other teeth that need to be cleaned before we put an implant in that environment. So to use a rubber stamp and say everyone can have the same therapy all the time, no matter what, I don't think is a way that I want to be approached.
Me either.
So I don't offer that as a blanket statement to patients. There are some patients who can have these things because they have a tremendous amount of bone, because the implant's not really in an area that you can see. So if the tissue moves up or down and there's some slight exposure, it's not going to make a major impact on the patient's appearance. So is it possible? Yes. But is it recommended for everyone like a rubber stamp? In my opinion, no.
Right.
I think that it's like saying you can have your haircut, your makeup, your earrings, whatever you want done, all by the same person, all in the same spot, all at once. It might be convenient, but is it going to come out the way you want it?
Right.
And with our bodies, with something that we want to last a long time, I'm not looking to go as fast as possible. I'm looking to do the best job that's possible. Right. So as you know, even though I placed the implant, that's just the beginning. You have to contour the tissues with a provisional restoration, a temporary tooth.
Right.
You have to have the patient look at what it's going to look like. What's the crown going to look like? Should we make an adjustment to the edge here? Would we bring out a little bit more? So working together with the patient is not something that's going to be done all at once.
Right.
And the tissue doesn't move all at once. We're dealing with biology, people's bodies. Nothing in our body really works all at once.
Right.
So
and everybody reacts differently to every procedure. So we have to gauge that as well.
There's a major benefit to the doctor to have everything done all at once, pay here, bye.
Right.
But I'm not looking to practice in that way, so.
And neither am I. So that's why we take our time. But everything is individually tailored to what you need and what's going to work best for you. So if you were a case that you could accept the implant and the crown and everything in one day, sure. But most people aren't that way. So we always, that's why we consult with you. We get data, we collect data and information that we need to come up with a treatment plan that works best for you. But, I don't know. Is there anything else you wanted to mention or?
Well, I think we've covered a lot of things today. I'm sure if the questions come up later, we can come up with other ideas to go a little bit more in depth.
Yep. Okay, so we're going to sign off, but I hope this gave you guys some good information about implants and who's a candidate and all that. So send me your questions, and I am happy to get to them.